Hi, everybody. This is Reid. Thank you for joining me today to discuss health insurance reform. It really is a pleasure to be joined by so many of you. The rhetoric surrounding this healthcare debate, excuse me, I lost my voice already. The rhetoric surrounding the healthcare debate has been increasingly heated. That's unfortunate. But understand, healthcare is personal for everyone. There has never been a piece of legislation that anyone can remember that literally affects everyone. There's an important piece of legislation, but usually it doesn't affect everyone. Healthcare does. That's why we're taking a whack at this. We've been trying to do something for 60 years. The time is now. This challenging time in our state, Nevadans face an economic crisis that lowered our home values, left many unemployed. We've also been hit with rising healthcare costs, and these costs are unsustainable for our families in Nevada. Today, $1 in every $6 in the country is spent on health care. If we fail to act meaningful, in just a few years, it'll be $1 out of every $3. Health reform is critical for Nevada health care providers. It's so important that we do something because not only do people have not good access to care, but because of so many people not having insurance, their health care providers are writing off $335 million at least in bad debt every year, and people with insurance wind up paying for this. Since the year 2000, your insurance premiums have gone up 60% in Nevada. So it's critical to small employees. It's critical for Nevada's children. 27% didn't visit a dentist in the past year. 38% didn't have enough resources to have a flu shot. So we're going to do healthcare reform. It's important we do that. It's important we do it as soon as we can do it. And we're in the process of having the final committee finish it, hopefully today, or not today, tomorrow. And in the next 10 days or so, we'll be on the floor with that legislation. And that's critically important. Let me just say a few things very quickly. First of all, there are a lot of rumors out there, a lot of myths. And I think it's important that we not be bound by these death panels. Senator Dan Inouye got on the floor today, senator from Hawaii. He's a Medal of Honor winner, a hero. And he said, I've never said this publicly before. But he said, my wife died 3 years ago. We'd been married 57 years. 10 days before she died, she said, I need to talk to you about something really important. She said, I'm going to die. The doctors have told me that after about 7 days, I'm going to go into a coma. I want you to make sure that we get our house in order. We've got to make sure the insurance is right and that they have one child is taken care of, all that kind of stuff. For these people to raise the death panels, as Senator Inouye talked about, is ridiculous. No one wants death panels. These rumors are ridiculous. The only thing in this bill dealing with anything regarding senior citizens is a provision that says, introduced by a Republican senator from Georgia, Johnny Isaacson, which says every year senior citizens should be able to visit with their doctor and find out what kind of care they need during the year. The other red herring or diversion that they have brought up in this legislation is illegal immigrants will receive free health insurance. Language in both the House and Senate draft bills explicitly prohibits federal payments for undocumented aliens, period. Abortion, another diversion. Health insurance reform doesn't mandate abortions or use taxpayers' funds for abortion. That's it. Some have said that, well, this bill is going to make private health insurance illegal. Neither the Senate nor the House draft bills makes private insurance illegal. And one they tried that is really a laugher. Government will have direct access to your bank accounts. Health insurance reform bills don't give the government access to your bank accounts. So there are a couple other myths out there. Rationing, health care would be rationed, simply not true. So let's get rid of that, the diversions, the myths, before we have this intelligent discussion on health care. We want to make sure that health care helps small businesses. And finally, before we turn over to questions, one thing I want to say is that in a conversation I had with President Obama, probably 6 weeks ago, He said, Harry, when we finish this, we have to make sure it's not just a program for poor people. It's a program for the American people. And that's something we always have to keep in mind. I said that would be final, but there's been a couple things come up on the news lately. The states that are most hard hit by the recession are Michigan, Oregon, Nevada, and Rhode Island. So the Finance Committee put a provision in their bill to help these four states with Medicaid. There have been a few Republican senators, I'm sorry to say, that are upset that I'm fighting for Nevada in this health care bill. They've come and said, why does Nevada, Rhode Island, Michigan, and Oregon get such a sweet deal? I've arranged for Nevada to get 100% match in federal funding for new Medicaid patients in the next 5 years. This is the right thing to do for a struggling state. And I don't make any apologies for standing up for Nevada. So don't let that diversion throw you off either. So I'd be happy to take questions now.
Senator Reid, our first question comes from Jonathan Abinet in Las Vegas.
Okay.
Thank you, Senator Reid, for fighting a good fight. In the final analysis, what we're concerned about after all the work is done in committee, is every American citizen, whether it be 47 million or 52 million without health care now,
yep,
are they going to have health care? Harry, I'm a disabled veteran, and I have my health care. But whether it be fully funding and fixing the VA, Medicare, or Medicaid, it seems to many of us that there must be a public option so no one falls through the cracks.
Let me explain, Jonathan. Let me explain to everybody on this line what Jonathan's talking about. You see, the insurance companies have a pretty good deal. They're the only business in America today, other than Major League Baseball, that is exempt from the antitrust laws we have in the country. What the public option is about is an option, not a mandate. It's an option. Give people a choice. And the reason for that is to keep the insurance companies honest, to create a fair playing field. I favor the public option. And before we're finished with this, I feel very confident we'll have a public option. It may not be the exact one I want, but we will have a public option. We have to do this to keep the insurance companies honest. Otherwise, I've told you what happened since 2000 in Nevada. Insurance rates have gone up 60%. Why? There's no competition. Next question.
Senator Reid, we have another question about the public option from Cynthia Kennedy in Virginia City.
Okay. Cynthia?
Yes, Senator Reid. Well, first of all, my concern is with our nation's debt. While everyone would like to have medical care, do not know how there will be the trillions of dollars available to pay for this, no matter how much is cut from Medicare. And also a part of that, and you can correct me if I'm wrong, but I've heard that there will be penalties involved for people who don't buy in. I mean, what I don't understand is if someone does not have the money to be able to buy into this system, should it come to pass, how would they even be able to afford these penalties? So how would they be penalized? Would they be put in jail for not paying for the insurance? There are also a lot of people, there has to be some kind of an identification card for this, and I would think the national ID would be the next thing to come. And as you might be aware, there is a very strong following of people who are very strongly against a national ID.
Okay, let's talk about, you asked several questions. Let's try to go through them there because they're all very good questions. First of all, the debt. The debt is a concern to everybody. But the debt caused by doing nothing is significant. People who have no health insurance or who are underinsured create all kinds of problems for all of us. Everybody out there who has insurance, they pay at least $1,000, probably more every year, to take care of the uninsured. So every insurance payment that you guys make, understand that should be worked into it. If we don't, and there are programs around the country we're trying to take a look at and adopt them into our legislation. Wellness programs. Safeway Stores has a real good program. And they're not some fly-by-night company. They're heavily unionized, good company, but on their own, they've created wellness programs that rewards their employees for exercising, not smoking, things of that nature. So the cost in the system now of not doing anything is really, really difficult. Medicare. Medicare is a program that is not perfect, but it's sure a lot better than what we had before Medicare, which was nothing. And when I was on the board at University Medical Center in Las Vegas, 40% of the old people that came there had no health insurance. Now virtually everybody does because we have Medicare. And please, Virginia, I keep calling it Virginia City, Cynthia from Virginia City, make sure you tell everybody there's nobody going to go to jail. We have programs set up here so that if some people do not comply with the programs, they're going to have to pay money, and that's the way it should be. We need to, if we're going to have everybody insured, you can't have some people taking advantage of those that belly up to the bar, so to speak. Finally, you asked a question about the ID card. I worked on the floor of the Senate and brought a bill to the floor that was supported by President Bush. He said so publicly, to try to have a comprehensive immigration reform bill. And even though President Bush spoke out and worked as hard as he couldn't get Republicans to support him. And as a result of that, we were unable to get comprehensive immigration reform. The leader of the immigration battle for several decades has been Ted Kennedy. As you know, Ted Kennedy died. The new leader of that subcommittee is Schumer from New York, and he's done a lot of work on that. We're going to do comprehensive immigration reform. And one of the things that he has talked about a lot is an ID card. And so your idea is not a strange idea. Your idea is an idea that Senator Schumer from New York is pushing. And for those of you who don't know anything about Schumer, even though New York is a fairly progressive state, Schumer is a real moderate. He is a deal maker, a very fine legislator. So thank you very much, Cynthia.
Senator Reid, next question comes from Kathy Laporte in Las Vegas.
Okay.
Thank you for taking my question, Senator Reid. My question is, I keep hearing about this $570 billion price tag on all fraud and abuse in Medicare and Medicaid. If it really and truly is that much, and I think it probably is, why isn't anybody doing anything about it right now?
Fraud, waste, and abuse is at least that much money. The one good thing about Medicare is its overhead is extremely low, a little over 2%. That's really unusual, but it's extremely low. But there's a lot of cheating goes on out there. And it's done through people who sell medical devices. It's done by double billing of physicians and other health care providers. And we believe, and the Congressional Budget Office and the General Accounting Office believe that we can recoup several $100 million. The exact number the CBO hasn't given us yet, but we believe hundreds of billions of dollars will be saved by our doing this legislation, by cutting out fraud and abuse.
Senator Reid, our next question comes from Joan Goggin in Las Vegas, who has another question about the public option.
Okay.
Senator Reid, first of all, let me say how much I love you and what you have done for Nevada. My question is, I'm madder than hell at the Democrat Senate. This Max Baucus bill is a disaster. Why are the senators voting against this public option? I cannot understand.
For those of you who don't know, Joan's one of my old girlfriends. No, I'm only kidding. Anyway, you should be mad. I'm not happy at all about the public option. But as I said earlier, we are going to have a public option. Before this bill goes to the President's desk, we're going to have some form of a public option in this bill. The vote in the committee It was 10 to 13. Every Republican voted against it, and 2 Democrats voted the wrong way. So we're going to be able to, on the Senate floor, we believe that there are a number of options that we have that we can get the necessary votes. So I feel very comfortable about that. I believe that, as I told Jonathan earlier, I believe that the public option is so vitally important to create a level playing field and to prevent the insurance companies from taking advantage of us as they have for so long. If they don't have something to keep them honest, they will just continue doing what they've done to Nevadans the last 8 years, and that is increase prices 60%. So, Joan, thank you very much for your nice comments.
Next question comes from Leon Warner in Gardnerville.
Leon, are you still there?
Yes, Senator Reid, thank you very much for taking my call. I have a question, and I'm not a big fan of the government being involved in any more of my life than necessary, and I think this health care thing pretty much gives them more control than I think they should have. But, you know, I buy my automobile insurance from a company in Hartford, Connecticut, and because I'm a senior citizen, I get a good rate. I know that health insurance won't give me a good rate because I'm a senior citizen, because they look at seniors and say, oh, they're getting old, so their health is no good. At 70 years old, I take one medication for my thyroid. I'm basically in a government program because I'm a veteran and I go to the VA for my medical treatment and my pills that I have to take. But I'm thinking it would be so much simpler to allow something like this to happen than all this fight that's going on between the Republicans and the Democrats and everybody else about health insurance.
Leon, let me say this. Last time I came home, you know, I live in Searchlight, so I land at the airport, and we always stop and buy groceries. There's not a grocery store in Searchlight, at least, you know, just a little convenience store. So we buy fruit and vegetables and some meat. Anyway, I walk in there, and there's a man walks up to me, and he said, "Are you Harry Reid?" And I said, "Yes, I am." He said, "Well, I'm from the state of Washington, and I want you to tell the government to stay out of my health care." He said, "I have had 2 cancer surgeries, one of the stomach, and then I had a tumor in my knee. My wife's had breast cancer. I want the government to stay out of my health insurance." And he was an old timer, I could tell. I said, "Well, who took care of all these bills?" He said, "Medicare." Well, that's a government program, and I am not for socialized medicine. I don't want the government running our insurance industry. I mean our healthcare industry. But let me say this: don't berate government healthcare programs. The Veterans Administration. It was 10 years ago that the Veterans Administration was a hiss and a byword the way they treated their folks. It is not good now. I mean, it's not great now, but it is very good. In fact, there's been articles written about it being the finest healthcare delivery system in America today. Medicare, as I said earlier, is not a perfect program, but it's a damn sight better than it was when I was at Southern Nevada Memorial Hospital University Medical Center. It's a better program than it used to be. So we need to get this done. We need to get it done because it's important that people in America, people in Nevada, the stories I've heard, even the last few days. Listen to this. Again, so I'm from Searchlight. I have somebody that helps a little bit with my house because I'm not there all the time, just a couple $100 a month to make sure the water lines haven't broken, all that kind of stuff. She worked part-time in the post office. She retired. Her husband worked down at Mojave Generating Facility in the southern part of the state. It went out of business because of all the pollution problems. He, in effect, is retired. They have a child, a 23-year-old boy. At age 23, you go after your parents' insurance. He went off. He had no insurance. He's like all young people, or most young people in America. They don't worry about it. They're not going to get sick. They're not going to get in an accident. They're fine. Within 6 weeks of his turning 23 with no insurance, he's diagnosed as having testicular cancer. He doesn't have any insurance. His parents are going to have to meet this burden. And that's why more than half the people who file bankruptcy in America today, it's because of medical bills. If this legislation passes, my friend Jeff at Searchlight would have had insurance. He would have had insurance. Now young people don't do it, and when somebody gets sick like that, the rest of us pay the bill. So, Leon, you raised a great question. I appreciate it very much.
Senator, our next question comes from Carla Daniels in Henderson.
Okay.
Hello, Senator.
Hi, Dan. Hi, Carla.
I'm so opposed to how you guys are trying to ram this health care bill through. Having said that, I think I probably speak for most Americans to say that we would like transparency. We would like to see this bill posted on the Internet at least 72 hours. I mean, I would much prefer to see a couple of weeks, seeing as this bill wouldn't take effect for years and years. Where do you stand on this?
That's a real easy one. First of all, ram health care bill down someone's throat. Remember, this has been going on through scores, dozens of hearings, public forums. There's been, all the time I've been back here, there's never been a piece of legislation that has had as much scrutiny as this. But let me just answer your question very directly. First of all, it hasn't been rammed down anybody's throat. We're taking, some say too much time, but I want to make sure everybody has enough time. And we, of course, post on the Internet. That's the law. We have to do that. That's the rules we have in the Senate. So everyone will have an opportunity to read this on the Internet. That's the way all of our legislation is. Okay, Ryan, next one.
Next question comes from Charles in Elko, who has a question about Medicare.
Okay.
Yes, sir. We understand this from what I've read in the paper and the news reports. I don't know if they're right or not, but you're going to cut Medicare by 10 or 15% in order for you guys to pay this bill over the next 12, 14 years or whatever it takes, to pay.
Mm-hmm.
If they cut my Medicare by 15%, man, I'm up a creek.
As the caller, let's see who it was, Kathy Laporte earlier, she asked about the fraud, waste, and abuse in Medicare, and there's a lot of it. And because fraud, waste is cut from Medicare, that's not going to affect you one bit. In fact, it will allow more money for other programs. We want to improve and save Medicare. We want to save Medicare. We want to reduce Part B premiums. We want to increase solvency. We want better equality. So don't you worry about your benefits in Elko or any place in Nevada being cut by 10 or 15%. What we are going to cut is money from these healthcare providers that take advantage of seniors through phony mail order programs and some of these scams you see on TV where they're selling this and that. So, Charles, tell your friends in Elko it's not going to happen.
Senator, our next question is from Mike Conway in Henderson.
Okay.
Mike, you there?
Thank you, Senator, for taking my question. I'm interested in understanding the money that the insurance companies are putting forward in fighting you on what you're trying to accomplish here, and why can't they be made subject to antitrust laws?
The late Paul Simon from New York, not the singer, but the senator, and I introduced legislation to bring the insurance company into the real business world and that they would be subject to the antitrust laws, and we didn't make that. Pat Leahy, the present chairman of the Judiciary Committee, has introduced legislation which I've joined him to do that. The way we're headed in this legislation now, I don't see a repeal, although I hope there's a vote on the floor in that regard, but I do see us hacking away at some of the advantages that the insurance company has, and that, my friends, is what the public option is all about. We believe that there has to be something to keep them honest. I repeat, keep the playing field more level. And let me answer your question. What have they done? all of this so-called turf battle that's been going on, these people, they aren't grassroots, they were AstroTurf. This was all financed by the insurance company, either directly or indirectly. All these meetings, remember interrupting the meetings? That's what this came from. All this has been driven by the insurance industry. They are spending money trying to destroy, divert. They're the ones that created all these myths that I went over earlier. Death panels, abortion, people that are illegal immigrants will get health care and we won't. So the insurance companies are up to this in their neck. Why? Look at the profits they're making. During these hard times, which businesses in America make the most money? The drug companies, the pharmaceutical companies. So thank you for your conversation with me, Mike.
Senator Reid, our next question comes from Patricia Wichter in North Las Vegas, who has a question about Medicare Advantage.
Yes, Senator Reid, I have written you, which I've never got response, but anyways, I'm very upset about your cuts in Medicare Advantage. I just turned 65 a few months ago, and I've got health issues, and you're taking away the Medicare Advantage is really going to hurt me. I only get $54 Medicare, and I work part-time as a crossing guard to supplement, and I'm very upset with you, and I hope you don't get elected this next year.
Well, I'm disappointed that you feel that way, but let's talk a little bit. First of all, Medicare, I've already talked to Mike in some detail about, Charles and Elko about Medicare just a couple of calls ago. Understand, right now everyone is subsidizing private insurance companies in Medicare. Medicare Advantage is not programs run by anyone other than insurance companies. Insurance companies are doing it. They're making huge amounts of money with this. Since the program was initiated, they've made $15 billion. And what is wrong with trying to level the playing field? I know seniors don't want those companies to reduce their benefits. I'm going to work to ensure that we're taking back money from the private insurers and that they don't pass it on to the seniors. That's what their game is. And these private insurance companies have sent people all over America and back to Washington, pay their way, people just like you, Patricia, saying, you go tell Senator Reid that I'm being hurt. He's going to take away our Medicare Advantage. That is a dream of the insurance industry. This is a game they're playing. And if people are going to accept the insurance companies as their friend, you better develop a new set of standards for who's going to be your friend.
Senator, our next question comes from Deborah in Winnemucca.
Winnemucca.
Yes.
I was there not long ago to a funeral for my friend Dr. Cannon, the veterinarian.
Well, I actually have two questions.
Okay.
One of my questions is, my husband is the only worker in our family, so he is the sole provider. However, we pay $1,000 a month for health care insurance.
Do you have children? I'm sorry.
Yes,
Deborah.
sir. We have 5 children at home.
Okay.
Our oldest being 19, our youngest being 6. But we pay $1,000 a month for medical insurance. Now, I would like to know if there's going to be a cap on what we pay, because this is killing us. And it's not based on the size of our family. This is based on the plan through my husband's employer for family coverage. You know, we pay a little bit extra because we have a better plan. However, $1,000 a month is outrageous.
There will be, Deborah, let me answer a few questions. With your one question, let me give you a couple of answers. First of all, I don't know what your insurance is, but I'll bet if we looked at it very closely, I'll bet there's a pretty sizable deductible there, and I'll bet that there's a cap that's not very high. When we pass this legislation, we're going to have a yearly cap, no yearly cap, no lifetime cap. If it's anything over that, the insurance companies have to pay it. You're a perfect example of why we need to do this. Your family, $12,000 a year. And if you look at your insurance, I would almost bet it's not very good. We want to have a program comparable to what I have. I have insurance with 8 million other federal employees. 8 million. Every year we have we call it an exchange, where every year they list the insurance policies that the insurance companies that want to write insurance for all of us, 8 million of us. And we can pick and choose any of those. There's usually 10 or 12, sometimes more than that you can choose from. That's what you would do. That's what this exchange is all about. It would be a program comparable to what we have. And in fact, the Health Committee, Health, Education, Labor, and Pensions of the Senate, they passed an amendment saying that whatever passed, we would have to go into it, we the Congress. So we hear where you're coming from. We want to fight the power of the insurance companies so that someone that has 5 children doesn't have to give an arm and a leg to be taken care of.
Senator, our next question is from Philip Krebs in Las Vegas, who has a question.
Is that Phil? Is that Phil?
Phil.
Okay, Phil Krebs.
Senator?
Yeah.
I've been writing you since the spring of 2006 when Massachusetts, under then-Governor Mitt Romney, initiated mandatory health insurance requirements for all of its citizens. I'm sure you're aware of the fact that Massachusetts is growing broke and there are heavy waiting lines for routine treatment. But I don't have health insurance. I'm not worried about it. If I do need medical treatment, I pay cash for it. My wife is Peruvian with U.S. resident. I'm a U.S. citizen, and I have Peruvian non-immigrant resident status. We spend about half the year in Peru, half the year in Las Vegas, Nevada. And in 2003, I was able to get prostate surgery down there. I needed it. It cost me $2,700 for everything. I've been told it would be 10 times as much in this country, but I take good care of myself. I walk about 5.6 miles every morning, and I don't want to be paying monthly insurance premiums. I'd like to use, it's taking money out of my discretionary income. I like to use that money for things to keep me healthy. I hike in the Peruvian Andes. I walk here when we're in Las Vegas. I walk every morning, get up when the sun comes up and walk for 5.6 miles. And I believe it's unconstitutional for the federal government to be forcing me to pay insurance premiums.
What happens, Phil, if you get really sick?
Well, I've got rental houses. I can sell them. I'll pay for it. I'm not going to be a burden on society. If I can get on a plane, it'll cost me $800 round trip to get to Peru. I'll go down there. I have friends in Peru who are not wealthy, who have had open heart surgery with the same physician who has operated on a Peruvian vice president with open heart surgery.
Do you like their healthcare system?
Pardon me?
Do you like Peruvian healthcare system?
Well, yes, I do. I'm very comfortable down there. My wife worked for 27 years as a teacher and as a high school principal. She paid into their S Salud health insurance. In fact, I sent you a whole package on that at the end of July. I've never got a response for you on it, but I'm happy with it. What I wrote you about, the HR 3200, there's a section in there on what exempts people from this mandatory health insurance you're proposing, and they refer to a section of the IRS code that exempts people who are non-residents, but to qualify for being a non-resident, according to the IRS code, you've got to be out of the United States for 330 days of a calendar year. I presented that in person to Representative Dinah Titus also, showed her a confirming letter I had from my insurance company. My wife, being a teacher, she enrolled me as her spouse in the insurance coverage down there. And yes, I'm very, very happy with the medical treatment I get in Peru. I was operated in a clinic run by German nuns and very clean, very efficient.
Let me respond. First of all, it's nice you take such good care of yourself. That's terrific. It's good you have the assets in case you get cancer and you have a $100,000 bill that you can pay it. Most people can't do that. The healthcare costs are so exorbitant that that's not possible. I would also say this. Most Americans don't like socialized medicine. That's what they have in Peru. So I would suggest that you are, it's great you're as independent as you are. I am familiar with the Massachusetts program, and one of the things we've looked at is things that have worked up there and the things that haven't worked. The things that haven't worked, we're not going to do those. And I would say this finally: one of the things we're trying to do with this healthcare delivery system we have is make it so that physicians want to be family practitioners, general practitioners. Most doctors today don't do family practice because they want to be specialists where they can make more money. The reason that people who are general practitioners have trouble making money is they have to charge so much for every patient. The more patients see, the more money they get, and it hasn't worked very well. If you look at models that deliver great care in America today, the Cleveland Clinic, the Mayo Clinic, and others, they have low cost and very high quality medical care. So I think that what we're doing is going to be much better than Massachusetts, and I'm glad Massachusetts did that. I'm glad Romney did that because we've learned a lot from them. We're going to have programs here to have more to entice more doctors to stay in family practice because it's we can't have a world of specialists. We have people that can take care of those people that are waiting in line up in Massachusetts. Ryan, next question.
We have a question from Maida Curls in Virginia City.
What is that first name? Maida, okay.
Hi, Senator Reid. Thank you for taking my question.
You bet.
And thank you for fighting so hard for Nevada. My question is, what is being done to address the correlation between the rise in healthcare costs and the increase in direct-to-consumer advertising by doctors, lawyers, hospitals, and pharmaceutical companies?
Oh, that's a terrific question. What a wonderful question. First of all, I think in this legislation we have to focus on something dealing with responsibility, and part of that is going to have to be something we take a look at lawyers. I think there are a number of things that we're planning on taking a very close look at. Number one, years ago I learned when I practiced law, went to one of these continuing legal education things, they said doctors, when they do something wrong, should say they're sorry. It would avoid a lot of this litigation. And sure enough, that's true. And because now if a doctor says they're sorry, that can be used against them in court. We're going to prevent that. Other things that we can do, I think for people going into general practice, we should give them a tax credit for their malpractice insurance. Drug advertising. My personal feeling is that people think that drug companies, every time we try to do something with drug companies, they come in and say, you can't do that, you need all this money for research. Well, about 70% of all the profits they make, they advertise. Time Magazine, any magazine, you see these medicines they have there that they recommend. And I've talked to physicians in Nevada, Reno, and Las Vegas. They say it's not even worth arguing with the patients anymore. They come in, they've read this stuff, that's the medicine they want, and most doctors say, if it doesn't hurt them, I'll just go ahead and give them prescriptions. It's easier to do that. Wasted money in the advertising. So all the advertising by these people who sell wheelchairs, sell other things, medical devices, we should slow it down some way. So anyway, made a good question.
Senator, our next question is from Steve in Henderson, who has a question about tort reform.
Okay.
Senator, thanks for taking my call. Just a 1-minute background. My wife has had serious medical problems this year. She's had 45 days in and out of the hospitals, and she's being treated by 5 doctors. All of the doctors indicate that part of their costs, a good portion of their costs, is from malpractice insurance. And it appears that the Democrats are not in favor of tort reform. Could you comment on that?
Of course. First of all, litigation of doctors is about 1.5% of medical costs, okay? It's something, and it's a lot of money. But I would just remind everyone listening here, I in my younger days, was a marathon runner. I've run thousands of miles. And one day on the Senate floor, I had a problem with I felt like my sock had gobbed up, like it was too big or something. So I went off the Senate floor and private took my shoe off. There was nothing wrong. What in the world's wrong with my foot? So I started going to doctors. They finally said I had what is called a Morton's neuroma, and they had to operate on my foot. So I'm there in the hospital with my little gown on, my feet down there, and I look down, and there's a great big magic marker X on my right foot. So I said to the doctor, why is that there? He said, so I'll operate on the right foot. That's where we're going to operate. I said, wrong foot, doctor, wrong foot. Now, if it had been my wife laying there to have a Morton's neuroma taken off her foot, and she had looked down there, she wouldn't have said it. My wife was born shy. She's always been shy, and she wouldn't have done that. She wouldn't have asked. I did, and got them to operate my right foot. Now, if they'd gone in and whacked my foot up, the wrong foot, and I'd still have to go back and get the other one operated on, I wouldn't have been very happy. That was clearly medical malpractice. And that's no different than someone who is drunk and runs through a stop sign and hits somebody. It's negligence, and it's not fair that the doctors get off. Now, I think there should be certain things that we do to protect them, and I mentioned one thing, a couple of things that I think are important. So I'm not blind to the need to do some things, but let me just say this. I will not use their name, because that would be wrong, but in my office here in Washington, I had some Nevada physicians come back and visit with me. They said, we're going to be really honest with you. He said, every time a patient comes to see me, every patient that came into his office, he saw dollar signs. He said, I have to charge that patient in one way or the other $300. I see 30 patients a day, $300 a patient. That's the only way I can cover my overhead. So a lot of the doctors complaining about defensive medicine is not altogether true. A lot of this is done to make money. So I believe that we need to do something with medical malpractice, and I've indicated some of the things that we're looking at, and I think those are an important step forward. But also there are some other things we can do. One of the things that we had in Nevada that worked quite well for a while was what we called a medical legal screening panel. And the committee's talking about doing something also similar to that, where if you're going to file a lawsuit, you have to get a doctor sign off and say, this is a good case. So, Steve, I'm sorry your wife is sick, but tell those doctors to take good care of your wife. Their only problem is not defensive medicine. They should just take care of your wife. And, we have 147,000 people in America every year that die because of mistakes made in hospitals and by doctors. 147,000. Now, Nevada already has caps that limits the amount. I disagreed with that, but they have it. So in effect, I don't know how to say this politely, but the doctors should stop whining about this and just take care of their patients.
Senator, our next question comes from Kelly in Wellington, Nevada, who has a question about immigrants.
Kelly?
Yes, hello, Senator. I've got a question for you about, we all know that there's a lot of medical services going to illegal immigrants, and I'm wondering how this new health care plan is going to limit that so that the people that actually pay the taxes are going to benefit more. Also, I would like to know approximately how many pages is this new bill going to be, and how much time are people going to have to look it over before they have to vote on it? Because that has been a problem here in the past.
Yeah, I have every Tuesday. Today's Thursday. Every Tuesday I have a caucus. Now, we used to do it on Tuesday. We did it yesterday because we had a Jewish holiday on Monday. But anyway, make a long story short, here's what I told my caucus. When the bill comes out of the Finance Committee, I'll put the bill together with the help of the two committee chairs in the White House, and I'll bring a leadership bill to the floor. That will be the bill that we'll ultimately be called upon to vote on. I told them before, you're going to be asked to vote on this, we're going to have a very, very long series of meetings where we will have experts go through each section of that bill and explain to all these senators what's in this bill. That's before we bring it to the floor. Now, as I told a number of people earlier on, once the bill is on the floor, it's on the Internet. Anybody can read it. How long is it going to be? I would assume it would be probably about it's probably 800 pages, long bill, because you're in a lot of legal jargon here, and it'll take anybody a little bit of time to read it. But it makes it much easier to read it if you do it the way that I said. I'll explain to the senators what's in. I won't do it, but I'll have experts come in and explain what's in each section. Now, let me talk about the question you asked about people who are undocumented. The legislation we're going to pass will give no additional benefits whatsoever to people who are here illegally. Period. End of conversation. This is a red herring. We're not going to have them have benefits that we don't have. I have time for one more question. I have a big meeting over with the House of Representatives, so I'm sorry to not have more time, but we've spent an hour. It's been a very good meeting for me, so I can take one more question, Ryan.
Okay, then our last question will come from Elizabeth in Gardnerville.
Okay. Elizabeth, are you there?
Good afternoon, Senator Reid. I have a comment on a story you had told about a family that had a son who was 23 and became ill.
Yep.
I myself have 5 children. They range from 23 to 5 years old. My husband and I are struggling to get 3 of them already that are in college. We're supporting them, trying to get them through. And right shortly after my daughter's 23rd birthday, she as well became ill with a heart condition. We have struggled, and we had to watch her suffer for months trying to find someone to help her. I am very ignorant in politics. My own fault. I don't follow them, which I'm ashamed to say. But it's very frustrating to me that when we did try and get her help, we were pushed away because she was not pregnant, she did not have a child, and she spoke English. It's killing us financially, and if your bill will help, more power to you, because people like us who have children that are trying, are in school, are working, paying our taxes, and cannot get help, but illegal immigrants can. It's very frustrating and heartbreaking to watch your children suffer.
Elizabeth, first of all, I have 5 children myself. You're not ignorant at all. You're very intelligent, obvious from this conversation. But under our legislation, kids will be able to stay on their, and remember, kids are always kids to us, on their health insurance until they're 26 years old. And under our legislation, your daughter will not be able to be denied coverage because she has a pre-existing condition. Under the law as it now stands, if you have a pre-existing condition, you have an extremely difficult, if not impossible, time to get health insurance. So we're going to take care of that. There will be affordable options for everyone, including special policies for young people, which is so important. Now, we're going to eliminate categories in Medicaid as well. I think what we're doing is headed really in the right direction. We have to stop having the insurance companies take advantage of the American people. They're running the healthcare system in America today, and it's wrong, and we're going to change that. Thank you all very, very much, everybody. I'm sorry we couldn't get more questions, but we did quite well. Appreciate it. We had state questions from all over the state. Thank you very much.